Well, I'm Amit Mathur, and the Chief Operating Officer here at Livecare. And myself and my partners, the founder, Dr. Mark Godley, who's the CEO, and David Wilton, who's a hospitalist at VGH. We've formed this company now, and it's been in operations for about 2 years, and it's a full scope telemedicine company is how we describe it. It's a physicians network primarily. What's interesting and unique about telemedicine is we're healthcare providers. We're doctors who've come together to provide a solution that we don't think, a solution that doesn't really exist at present, and there's a niche out there that's for our service versus an IT company providing a solution and having adoption from physicians. We've been on the other end of the delivery, and it's difficult for true implementation when you have doctors and health providers and nurses, and we'd like to come from the ground, the grassroots, and develop a solution we know is needed and that others will uptake, if you will. We use a lot of words in telemedicine. We call it distance medicine or M-health, or really it's anything from using a telephone to the newer gadgets that we have, our phones and communication tools, video conferencing, diagnostic tools that allow you basically communication with a patient from afar. A health provider, whether it be a physician or an allied health professional, for instance, a dentist, a nurse, or anybody really. Treating from afar is I think, the realm of telemedicine, where the patient is not in front of you, and telemedicine is the means, if you will, usually using the internet more so than just the old school way of a phone consult, if you will. But it's doing medicine from afar. Well, it's really interesting. We're being in British Columbia and doing medicine, me and my partners, in rural communities. We know there's a major difference, an issue with patient access to healthcare. We have a rural, it's not just a problem in British Columbia, but if you look at the geography of Canada, we have physicians who tend to congregate in urban centers because of hospitals or research opportunities for them, but we have a lot of our population spread around thin across many different geographic rural sites, if you will, cities and towns, and now working camps and all sorts of different scenarios. What we've begun to do with Livecare, and specifically here based in Vancouver, is the ability to look at both urban and rural, if you will, scenarios where there's a need in patient access, a drop-in service. And we go in and are able to provide and link physicians and patients, or clinics or municipalities for that matter, where we can link the patients and doctors that don't usually service that community. So to give examples, in urban centers, physicians who want to take care of their own patients, if you will, while they're away or as their own locums, or can make their own practices more efficient, provide greater access to their patients so that they can video conference with their own patients to provide longitudinal care for them within their practices. That's something we've been doing. A recent example is of an actual community, if you will, a municipality that has had issues with finding physicians, is Taylor, BC, and it's one of our probably very rewarding already in the last week to see the response from the community, and how we've worked already to provide physician services from within almost 6-7 weeks of actually engaging with the municipality and the council at Taylor, and Mayor Jarvis and the council there. Just awesome partners, and we were able to show how utility of not only is it the telemedicine, but the system, if you will, that we have, a hybrid system of continuity and longevity care, really works. And that's to me the epitome of what telemedicine can do. Telemedicine, if you will, and even us, if you ask Livecare, We truly believe that telemedicine, the technology, is a part of the puzzle. Another tool in the doctor's old bag, if you will, to enable a physician to provide service. And in our mind, it will be a part of, I would think, in the next 5 years, that almost every physician to some degree will be touched by an aspect of telemedicine in their own practices or in an institutional scenario that they're working in. It's where telemedicine is going. Today, with access to wonderful high-speed internet, with infrastructure, and the way that, if you will, gadgetry is developing science and tech is really moving this way. And Livecare's thought process, if you will, is can we merge the gadgetry that's out there. Our platform, if you will, on the software allows for, from stethoscopes to, all sorts of gadgets and scopes to look down your throat and look in your ears. Can a doctor from afar put all those information together on one platform, see it live, if you will, if needed, and also communicate with the patient, or even collaborate with a patient, a physician, a nurse at one time to better treat the patient.